Achilles tendinitis simply is just inflammation of the Achilles tendon that sometimes can be what we consider non-insertional, meaning within the tendon itself, or sometimes insertional, so where it actually inserts onto the heel bone or the calcaneus. Both of them are due to usually a tight calf muscle or too much tension on that Achilles tendon. They're exacerbated by prolonged weight-bearing activities, usually worse first thing in the morning because when you sleep, your foot relaxes, and then that first step really stretches out that back of the Achilles, back of the leg. Non-surgically, we'll typically start with physical therapy, working on stretching the calf muscles. We can get you some little wedges to put in your shoe to lift that heel a little bit, so if you don't have to get that foot all the way to 90 degrees or a little bit past, that can help a little take the tension off the Achilles tendon. Some anti-inflammatory oral medication, sometimes even the topicals can be helpful because it is pretty superficial there on the back of the ankle. Ultimately, 90% of people don't need surgery for their Achilles tendinitis. We can get the symptoms to go away without surgery. There's a couple of different surgical options. One, we lengthen the calf muscle. It's about a 15-minute surgery. You walk in one of those gray boots or the black boots that you've seen people probably out walking around in for 2 weeks and then sleep in that boot for 4 more weeks at night. It still takes probably 4 to 6 months to get your full strength for like running, jumping, and things like that back, but you're at least mobile and walking the whole time. The other option is we go down to that insertion of the Achilles on the heel bone and we do what we call a debridement, which means that we just remove any of the inflamed or diseased looking tendon. If the rupture occurs in someone who had tendinitis and had been experiencing symptoms for a long time, a lot of times we recommend surgery for that. If you're a high-level athlete and you get an acute rupture, we tend to recommend surgery for that as well. If there's no significant uniqueness about you as a patient that says, oh no, you're gonna need the highest function of this Achilles for the rest of your life because it pays your bills, or because you're young enough that we don't know if it's gonna pay your bills, then typically we can offer you conservative treatment or non-surgical management of an Achilles rupture as well.